Good morning and welcome to the show. We're broadcasting almost live from the fabulous Fox Studios. How did that go, Bob? Fabulous Fox Studios, furnished by Fohan Furniture, the famous Fohan Furniture here in Panama City. Well, now that I've done all that, welcome to the show, Wanda.
Thank you, Don. Glad to be here.
Yeah, Wanda McDonald, you're with
Lynn Haven United Methodist.
Lynn Haven United Methodist Church. I had to get that little plug in for
Yes.
Fohan, but at any rate, and they're wonderful people there.
Yeah.
But you guys are wonderful people over there as well at United Methodist Church in Lynn Haven, because you're hosting the Warrior Beach Retreat this year, aren't you?
Yes, we are. We are hosting the opening ceremonies and dinner for the Warriors on September the 18th. And we're excited. This is actually our second time doing it. We did it last fall. And it's just such a wonderful, wonderful outreach, wonderful way to touch these warriors, and the whole community gets involved. So we love doing it.
Yeah, it is an amazing thing. And I've had Linda Cope on the show multiple times. And when we had News View on the other show in the evening, we had her on there too. And you know, just incidentally, you know, I was at that very first welcome home ceremony for Joshua Cope at the Marina Civic Center while I was still serving in uniform.
Yeah.
So, you know, it really hits home that this community can rally like that to help our wounded warriors.
That's really the wonderful part about this program, is that it is it's totally the Panama City and Bay County community that does this. Linda and her husband spearhead it because of Joshua and what they saw, what he went through, what his wife went through, trying to recover from his severe wounding. And so they bring 25 warriors and caregivers down in the spring and in the fall, and just show them a wonderful time. The businesses give cars for the week, condos for the week, all kinds of activities for them. It's really amazing what this community does.
Dinners, fishing trips, all that stuff.
Oh yeah, it's absolutely amazing.
And I was an escort for a year or two.
Oh yeah.
Yeah, we would get to pick them up from the airport and bring them into town to the Toyota dealership to pick up their cars.
Exactly. It's amazing what they do for them.
And the funny thing is that these young people are so grateful. I mean, and what we're doing and what you guys do is just so small in comparison to what they've done.
It is so small, but when they arrive in their cars, they have tears in their eyes because they have been welcomed and applauded all the way from the hotel to the church. People line the streets. It's an amazing thing to see. It really is.
It is an amazing event, and it's such a worthy cause. Now, we've got to run off to the local weather, but after that, I want to talk about the event that you're planning.
Sure.
That's going to be on September 18th. Is that right?
That is right.
All right,
September
great.
18th.
Well, we're going to talk more about that after your local weather, brought to you by the West Pittman Law Firm, westpittmanlawfirm.com. Welcome back to the show. I'm speaking with Wanda McDonald from Lynn Haven United Methodist Church, and we're talking about Warrior Beach Retreat, and you guys are hosting it.
We are. We're hosting the opening ceremonies. It's going to be this Thursday, the 18th, at the church. We're located at 4501 Transmitter Road, and it's at 7 p.m., and we really encourage all the community to come out. It's an hour program. It's a very uplifting program. We will be recognizing all the different branches of the service as well as the different wars and conflicts. So we encourage our military, our veterans to come out, but really the community as a whole, because it's just a wonderful, uplifting program.
Do I need a ticket or anything to go, or can I just show up?
You don't. You can show up. It's free. We would also really encourage everyone to line the parade route. They'll be starting at the Grand Panama Resort at 4 p.m. They'll be going around Thomas Drive, across the bridge, 23rd Street, Highway 77, 390, and then Transmitter Road to the church.
So you would tell people to go out there and turn out for that. And
absolutely, and they can actually go to the Warrior Beach retreat.org and find the parade route and find out where they'll be at each given time between 4 and 5 p.m. and go ahead and claim their spot.
Just claim your spot. Yeah. So really, to get the authoritative word, you really need to go to the website, which is warriorbeachretreat.org.
Correct.
Is that it?
That
or
is.
If you're lucky enough, you could actually ask Linda Cope herself,
you could.
who is the expert on this whole
if
thing.
she were only here.
Yeah, I know.
You know?
Yes, another great moment in
in the
cheesy TV,
neighborhood.
brought to you by.
Welcome to the neighborhood, Linda.
Thank you. I was in the neighborhood today.
Well, thanks for stopping
Oh,
in.
you're welcome, Don.
Well, it's good to see you, Linda. You know, we're having fun with all of this right now, but this is really serious stuff.
It
I mean,
is,
we've
it
got
is.
these kids, these young men and women who have lost limbs. We not only that, but you know, as we all know, not all of these injuries are visible.
Right.
Some of them have traumatic brain injuries or PTSD or things like that. I mean, you know, it's the least we can do as a community, don't you think?
Definitely.
Absolutely. And there's such healing that comes with people lining the parade route. And like Wanda said, it's on our website, warriorbeachretreat.org. We are not affiliated with Wounded Warrior Project, total separate. We're in Northwest Florida, grassroots American charity. We're local. We're
So
local.
this is Northwest Florida's offering to our warriors, really.
It is, it is. And with things going on in the nation today, I think there's a greater appreciation of those who are serving and who have served. And
Yeah,
it's
that's
we
very
need to
true.
always remember them, that, you know, without these men and women and people like you that served, where would our nation be?
Well, you young ladies may not remember, but I do remember the Vietnam War. I was of age at that time, just of age, of course. You know, and we've matured a lot as a country since then.
Yes.
Thank goodness.
You know, I mean, those returning veterans didn't get much of a welcome back.
Well, we've got 5 of them. Every time we do these retreats, we have 5 Vietnam vets and their loved ones riding in our parade, joining us for the supper and the ceremony. And their lives are forever changed because they get the welcome home they never got.
So it's not just the young people who are
That's
engaged
right.
in conflict now, but it's the Vietnam guys as well.
And they're in the front of the parade in their vehicles with their names on the side, so you'll recognize them.
Better late than
So
never,
give them
and that's what I
a
gotta
big
say.
hurrah as they go by.
Absolutely.
All right, well, Linda Cope and Wanda McDonald, thank you so much for the good work you're doing. That's this Thursday at Lynn Haven United Methodist Church, and we'll be right back after your Mad Hatter Minute.
Hi, I'm David Lovett, and this is your Mad Hatter Minute. Your air conditioning system uses a refrigerant gas called Freon to create cold air. The most common reason an AC stops blowing cold is due to a loss of Freon. Refrigerant is a gas in the AC system, and very small holes in the hose, seal, or couplers can allow enough Freon to leak out to prevent the creation of cold air. If your AC system is not blowing cold due to a lack of Freon, it's important to identify the part that's leaking, replace the part that's leaking, and flush the entire AC system. Over time, the inside of the AC system can deteriorate and become contaminated with various bits of debris. These contaminants can clog up the different components of the AC system, preventing proper circulation of the refrigerant. Even worse, contamination can restrict the flow of Freon to critical AC parts such as the AC compressor. Failure of these parts can lead to a costly repair. The only way to clean your AC system of contaminants is flushing the system when repairs are done. Not flushing the system is a substandard repair and will lead to more AC problems down the road. Lastly, if your AC isn't blowing as cold as it used to, check the serpentine belt. A loose serpentine belt or worn serpentine belt leads to belt slippage, which puts additional strain on the compressor. Replacing your serpentine belt as scheduled will increase the life of your AC compressor. I'm David Lovett, and that has been your Mad Hatter Minute.
Hey folks, this is Joshua Brown with Mad Hatter on 23rd Street. Is your check engine light on? If it is, text MADHAT28, that's MADHAT28, to 24247 and we'll check it for free.
Welcome back to the show. I'm here with Dr. Tara Griffin at Emerald Coast Dental Sleep Medicine. Thank you for letting us behind the scenes one more time. We were talking about sleep apnea, and there are different ways of treating that, but you can have different symptoms from mild to severe.
Yeah, you can have different diagnoses as far as you can be diagnosed with mild sleep apnea, moderate, or severe. And that depends on how many times you stop breathing during the night and for how long you stop breathing. So the severe is very bad to have. That could take 10 years off of your life if you're not treating that on a nightly basis. But just because you're severe, it doesn't mean that you're going to be symptomatic with it. You may not realize, and that's the most dangerous situation. Patients can have mild sleep apnea, however, they are so fatigued and tired during the day, you would think from the way that they feel that they would be severe, and they're not. So it's hard to know sometimes. That's what the test shows.
So you could have, no kidding, apnea, but your body has figured out a way to cope with that.
It does. It tries to cope. It tries to overcome these problems on its own. That's what the body's designed to do. And so we will not realize sometimes we could have this fatigue and different types of problems going, but we think that that's normal because we've been dealing with it for so long.
You're just used to being tired after lunch all the time.
Yes.
Now, everybody I've known, when I was in the service who had sleep apnea has been given a CPAP, this big clunky machine that gets strapped onto your head and then you try and sleep with that on.
Yes.
And that's what doctors recommend for the most part.
They do, and CPAP is very good, and it is a first line of treatment for severe patients with sleep apnea. However, the American Academy of Sleep Medicine has changed their guidelines over the last few years, and they have actually made oral appliances such as these a first line of treatment for mild to moderate patients. So if you're mild to moderate as far as your diagnosis, you don't have to start with a CPAP for your first line of treatment. You can actually start with something like an appliance and then go from there. If you're severe, first line of treatment is the CPAP. However, some people know before they even put it on that they can't tolerate it, and then therefore the appliances come into effect for that situation as well.
And without the appliances, and you just have a CPAP doesn't really cure sleep apnea. It just really treats it and helps you get through the night.
It manages it, and it's very effective if you can tolerate it. That's why it's the gold standard as far as treatment goes. The problem lies in the ability for patients to tolerate it. On average, about 2/3 of the patients that are prescribed a CPAP cannot tolerate it for an extended period of time. Normally, after a few months, it ends up in the closet. And we really want to help treat those patients that have the CPAPs in the closets that are at risk for all these medical problems and not getting treated.
And you could do that with these appliances. Just anecdotally, I knew a fella who had the operation done to cure his apnea. And it was tough. It was a real painful procedure, and he was out of work for a really long time after that.
It is. It is an option for treatment for some patients. However, the effectiveness of that, studies have shown, are about 40 to 50% effective, and it is painful. It's very invasive to go in and actually remove tissue in the back of your throat. Some people need it, but most people don't. So it is a last resort type of situation for most patients when they're appearing within normal limits of treatment. The effectiveness of these appliances start at 70% and go all the way up to 100% for some people, and with a potential cure. So the effectiveness is much better with the appliances.
So you can actually get better results without surgery.
Oh yeah, absolutely.
And
sometimes you need combination, but most of the time you don't.
It's almost like the whole package too. It helps treat it and cure it all at the same time, doesn't it?
Some of the appliances do. Yeah, we do have treatment options treating towards a cure.
Well, maybe we could take a look at one of these things. Now, what are these called, and who would you prescribe it to?
These are called oral appliances, meaning you wear them in your mouth at night while you sleep, and they're different types. These are two here that actually bring the jaw forward while you sleep at night, and it doesn't allow the jaw to fall back. Typically what will happen is when you sleep, the muscles will relax in your airway here, and that jaw will slide back. The tongue will fall back, and it'll block the airway. So these allow you to actually stay more forward, so it splints the airway open back here when the muscles relax. These appliances have been around a very long time. They manage the problem much like a CPAP would.
It's kind of amazing to me, and maybe we can talk more about it another time, but are doctors really aware of these things? Not so much.
We're working on it.
Okay. We're going to have to let that be the last word. And we'll be right back after these messages. Welcome back to the show. I have Dr. Stephen Favaloro from Forest Park Animal Hospital to give us our pet health tip of the week. So, Doc, what are you thinking about this week that might improve our pets' happiness or well-being?
One of the things I was thinking about we could talk about would be, children and children's behavior around pets.
Oh boy, I've seen that, like little toddlers pulling on ears, and laying on top of the dog and stuff like that.
Absolutely, a lot of people, like, my child is great with pets. Well, just because the family dog is tolerant of, your child, pulling on their ears, pulling on the tail, laying on them, doesn't necessarily mean that behavior is, even, well received by that dog. He's just tolerant of it, and certainly other people's dog. You do those kind of things.
Oh, you don't want to pull that with a dog you really don't know.
No, and children who are not even old enough to go to preschool, that 5 to 7 range and under, they don't have what's called empathy awareness. They're not aware of what they're doing might actually injure another being. And so, to leave those children unsupervised, or even with an older child, like say an older child who's 10, 11, 12, if the person who's supervising can't control the actions of both the child and the dog, then, you probably need a more appropriate supervisor.
Yeah. I mean, and it is about, the dogs will put up with so much. And it's funny that you say that, this empathy awareness when they're not aware of another being. And, dogs are beings.
Absolutely.
And they have their own little consciousness and their personalities and all that. That's why
and,
we love them so much.
And you might be there and your child may give you all the right answers and may act, appropriate when you're watching. But, turn your head for a minute and watch them experiment. Watch them do things that they wouldn't do in front of you, because that's how the human mind works. That's how we learn. So, things that, people do, that may not be necessarily appreciated by pets, like, obviously, the pulling on the ears, poking in the eyes and the nose.
Anecdotally, my niece, when she was a baby, my sister had a German Shepherd. She would pull the dog's tongue right out of his mouth. And the dog would stand still for it, but
it probably didn't appreciate it. That's another thing too, is if that behavior, continues and the dog, may not appreciate it and is waiting maybe for somebody to stop it. If eventually it doesn't, then the dog's perception is like, this child may hurt me. And so eventually when they get old enough and their defense maturity comes into play, they may have to, a lot of times they will defend themselves. And when that happens and when action's already taken, all the damage is already done as far as like that dog's perception of children and, maybe that they feel like they're going to.
Yeah, that relationship is damaged thereafter.
Absolutely.
And then
for all children, not just that one.
And if a dog snaps, somebody's got to go, and it's not going to be the kid.
No, it's not going to be the kid. It won't be the dog's fault, because the dog was put in a situation that it was at a disadvantage already. But other things too that we don't think about. Just kids swing things. Bats, the plastic bats, towels. Even though they don't think that they're going to hit the dog, and they may not even know the dog's are trying to do that. The dog may perceive it as coming at it. Getting up real close in a dog's face. That's
they got their own personal space, just like we do, right?
And I remember sitting on the bed, me and my wife and the kids, and we're all sitting there, and the dog's here. And my son just kind of, goes across the bed. And my little dog hit him right in the cheek. Didn't hit him hard, but I was just like, it's almost like a train wreck. I saw it coming, but you couldn't stop either one of them fast enough. And they'll do that just, that quick. As far as, a dog who's like sleeping, or resting, just laying there, or a dog that's on a chair and you run up real close to it, or, particularly, a dog and it's, a mother who's nursing, puppies and things like that.
Oh, yeah.
They're
when I was a kid, I got to tell you another little Don area story. Right. When I was a little kid, my dog had a litter of puppies. And I had them in the garage, and we had a detached garage up in New York. And I had a friend come over, and I was probably about 12 years old, and he leaned over to look at the puppies.
Oh, yeah.
Dog jumped up, bit his lip.
Absolutely.
Emergency room, got a couple stitches.
Absolutely.
Yeah.
The very maternal aggression there. As far as like dogs and, with food bowl, you go up to their food bowl, you got to make sure that that's, something that is supervised. Pulling on toys, playing a tug of war. I mean, an adult, an older child, you can kind of get a feel as to whether that dog is playing versus not playing, but a young child,
there comes a point where dogs get real aggressive. They get carried away with that game.
Going into a neighbor's yard, it's, you're not familiar with, you're outside, that even something as much as like your neighbor has a fence, sticking your hand through the fence, that's something that we running from dogs, their instinct is to chase.
So I guess the key, Doc, is just to supervise your children and your pets pretty much at all times.
Absolutely.
Well, that's our pet health tip for the week, and thanks a lot for coming on the show, and we look forward to another one next week.
Thank you very much.
All right. And we'll be right back after these messages.